You feel fine, no headache, no chest pain, no warning signs. Yet inside your body, your blood vessels may be under constant strain. Hypertension, also known as high blood pressure, is called the silent killer for a reason. It damages your heart, kidneys, brain, and blood vessels quietly for years before symptoms ever appear. But what if part of the problem isn't just salt, or stress, or genetics? What if one overlooked mineral, magnesium, plays a bigger role than we've been told? And what if modern food, especially high fructose processed foods, is quietly making things worse? Today we're going to break this down clearly, scientifically, and practically. Blood pressure is the force of blood pushing against the walls of your arteries. When that pressure stays elevated over time, typically 130/80 mmHg or higher, we call it hypertension. Think of your blood vessels like flexible garden hoses. When they're healthy, they expand and relax easily. But when blood pressure stays high, arteries stiffen. The heart works harder. Microscopic damage accumulates. Plaque builds faster. Organs receive less efficient blood flow. Over time, this leads to heart attack, stroke, kidney disease, heart failure, vision problems. Now here's the key question. Why do blood vessels become stiff and resistant in the first place? That's where magnesium enters the conversation. Magnesium is involved in over 300 biochemical reactions in the body. It helps regulate muscle relaxation, nerve signaling, blood sugar, heart rhythm, vascular tone, how tight or relaxed blood vessels are. Magnesium acts as a natural calcium blocker. Calcium makes muscles contract. Magnesium helps them relax. Since blood vessels are made of smooth muscle, magnesium helps them stay flexible and dilated. Low magnesium, vessels tighten, resistance increases, blood pressure rises. A major systematic review and meta-analysis published through research supported by the National Institutes of Health, NIH, examined observational studies looking at circulating magnesium levels and hypertension risk. The key finding: circulating magnesium concentration was inversely associated with odds of hypertension in a dose-response manner. Let's translate that into plain English. Inversely associated means higher magnesium, lower odds of high blood pressure. Dose-response manner means the more adequate the magnesium level, the lower the risk. This wasn't a small single study, it was a systematic review, meaning researchers analyzed multiple studies together to identify patterns. And the pattern was clear. Low circulating magnesium levels were consistently associated with higher blood pressure. That suggests magnesium is not just nice to have. It may be protective. Here's where things get interesting and concerning. Modern industrial farming prioritizes yield size, shelf life appearance. But soils are often over-farmed, not rotated properly, treated with synthetic fertilizers that replenish nitrogen, phosphorus, and potassium, but not trace minerals like magnesium. Over time, soil minerals are depleted faster than they can replenish. The result? Food looks the same. Spinach looks green, carrots look orange, apples look shiny. But mineral content, including magnesium, may be significantly lower than it was decades ago. So even people who eat healthy may unknowingly consume less magnesium than previous generations. Now, let's talk about a major modern dietary factor: high fructose intake. Fructose is found naturally in fruit, but the problem is concentrated processed fructose, especially high fructose corn syrup, sugary drinks, processed snacks, sweetened cereals, packaged sauces. Here's the mechanism. Step 1. High fructose intake. Step 2. Increased uric acid production. When your body metabolizes excess fructose, it generates uric acid. Step 3. Uric acid blocks. Nitric oxide. Nitric oxide is crucial because it relaxes blood vessels, promotes vasodilation, improves blood flow. When uric acid levels rise, nitric oxide production decreases. Blood vessels lose flexibility. Step 4. Blood vessels stiffen. Step 5. Blood pressure increases. So the pathway looks like this: high fructose, uric acid, nitric oxide, vessel stiffness. blood pressure. And if someone already has low magnesium, now you have reduced vascular relaxation, low magnesium, reduced nitric oxide, high uric acid, increased stiffness from both sides. That's a dangerous combination. Magnesium helps improve endothelial function, support nitric oxide production, reduce inflammation, and improve insulin sensitivity. When magnesium levels are low, endothelial dysfunction increases, inflammation rises, insulin resistance worsens, and blood pressure regulation becomes impaired. Magnesium doesn't work alone. It works in a network of vascular protection. When large amounts of fructose are processed in the liver, the body produces uric acid. Excess intake accelerates this process. Higher uric acid levels can irritate the inner lining of blood vessels, called the endothelium. This irritation disrupts normal function. When the endothelium doesn't function well, vessels lose part of their ability to relax. Relaxation is essential for smooth blood flow. Less relaxation means more resistance in the arteries, and that resistance can raise blood pressure. Magnesium supplementation has been shown in multiple studies to modestly reduce blood pressure, especially in individuals with low intake. Common forms: magnesium glycinate, gentle, well-absorbed; magnesium citrate; magnesium malate; magnesium threonate. More for brain support.
However, supplementation should be individualized, especially in people with kidney disease. Always consult a healthcare professional before starting high-dose supplementation.
When both systems are affected, lower magnesium levels and reduced nitric oxide signaling, the body loses two important tools it normally uses to keep blood vessels relaxed. That means arteries may become tighter and less flexible over time. And when arteries remain tight, the heart must push harder to move blood through the circulation. That extra pressure is what we measure as high blood pressure. If you want to reduce your risk, reduce processed fructose intake, eliminate sugary beverages, minimize packaged snacks, increase whole food magnesium intake, improve soil-aware food choices, support regenerative farming when possible, stay physically active. Exercise improves nitric oxide production. Prioritize sleep. Sleep regulates vascular tone. Manage stress. Chronic cortisol elevation affects vascular resistance. Hypertension is silent, but it's not mysterious. Your blood vessels depend on relaxation signals, mineral balance. Nitric oxide. Healthy endothelial function. Research supported by the National Institutes of Health has shown that circulating magnesium levels are inversely associated with hypertension risk in a dose-response manner. At the same time, modern diets high in processed fructose increase uric acid, block nitric oxide, stiffen vessels, and raise blood pressure. Food may look the same, but mineral density is not what it once was. The solution isn't panic, it's awareness. Protect your blood vessels. Protect your minerals. Protect your nitric oxide. Protect your heart. Because high blood pressure doesn't start with symptoms. It starts silently, at the cellular level. If you found this helpful, subscribe for more medically accurate, evidence-based breakdowns of complex health topics made simple. Stay informed. Stay healthy. Medical disclaimer. This video is for educational purposes only. It is not a substitute for professional medical advice. Diagnosis, treatment. Always consult a qualified healthcare professional about your health, medications, or supplements. If you have symptoms or an emergency, seek immediate care.